Tuberculous abscess complication. Tuberculous abscesses are a relatively common complication of tuberculous spondylocystitis, and it is not uncommon that in these cases there is also involvement of psoas or paravertebral muscles, even years later than the diagnosis of TB.
Saw this patient walking and I knew this is a case of tuberculosis of spine. See her spine, just walk. इधर आगे आओ, जल्दी से आओ. Now she has got a guarded movement. यहाँ आ जाओ, सामने हो जाओ. चलो और पीछे कमर में दर्द हो रहा है, पीछे घूम के दिखाओ. Now she is walking smoothly, but when she had come, she had a very guarded movement. And now if you see her spine, you can see that the lower half of the body of L1 is destructed. There is a cavity here. And if you see the AP view, show the AP view, Priya. Now in the AP view, you see that there is a destruction on the right side and there is a curvature on the right side. And if you see the shadow of the psoas, this looks normal on the left side, and on the right side you see that psoas is, the marking is dilated. So I'm sure she's got a psoas abscess. So we'll just go in and remove the abscess and fix the spine in a normal anatomical position.
Causes: Usually the primary abscess occurs in children under 30 years of age and is associated with S. aureus in 85 to 90% of the cases, while 80% of the secondary ones originate from the gastrointestinal tract, where up to 60% arise as complication of disease of Crohn's, with other causes that follow came from appendicitis 17%, disorder of the colon 11%. Consequence: in Indian infection of the beginnings of the bone, bone infection can lead to the formation of epidural abscess. The abscess enlarges and compresses the spinal cord. The infection can spread to the nerve itself. An abscess in the spinal cord is red. What it happens can be deadly. Bowden's disease begins in the vertebral body near the disc space in a characteristic way. Two vertebrae are affected and the medial disc space is narrow but calcified, unlike metastatic carcinoma which injures the vertebra without narrowing the disc space. If the disease is not diagnosed or treated timely, vertebral collapse and paraplegia are possible. For this reason, if localized back pain persists or worsens, studies should be repeated.
Spinal infections might be caused by miscellaneous germs, including bacterial agents like staphylococci or, much less often, by Mycobacterium tuberculosis, or by various fungal diseases. Generally, microbes enter the spine through the bloodstream. For instance, through intravenous injections administered using contaminated needles. A primary infection somewhere else in the body, like an infection of the respiratory, gastrointestinal, or urinary tract, can enter the bloodstream and spread to the spine. However, infectious agents may also reach the spinal tissues through a wound after surgery or following other invasive treatments of the vertebral area.
Usual blight in Ecuador. In Ecuador, tuberculosis is an endemic disease that affects several cells. The most recent epidemiological data of pulmonary and extrapulmonary tuberculosis of the year 2011 are morbidity rates. Incidence rate considering 100,000 inhabitants, while the mortality rate has been declining since 2005, which was 5.88 per 1,000 inhabitants behind the 2013 in 2.43 per 1,000 inhabitants.
world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. Mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks, and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
Conclusion: Histopathologically in tuberculosis is common the presence of granuloma tuberculoid, which is an accumulation of histiocytes epithelioids and GM cells type ligands, which have a variable degree of central necrotic calcifies and peripheral ring lymphocytic. This finding does not confirm the presence of TB, however is suggestive. Other infections such as leprosy, syphilis, granulomatosis, rosacea, leishmaniasis, fungal infections, profundations present with tuberculoid granulomas.